Hi, my name's Frank Quinlan and I'm the Chief Executive Officer of the Mental Health Council of Australia. And today the Mental Health Council of Australia is launching its next submission to the National Mental Health Commission's review of mental health in Australia. You might remember that this review was announced as a pre-election policy by the Coalition and following their election they've asked the Commission to review mental health across Australia, and we've been working with the Commission to try and convey the views of our members and stakeholders as strongly as we can. Today's submission really calls for a decade-long reform. What we're trying to say is that we can't fix mental health in Australia if we adopt a piecemeal approach. If we're just tweaking the knobs, turning a little bit of this program up and a little bit of that program down, we're going to fail to deliver the sorts of programs and services and supports that people who experience mental illness and their carers really want. Importantly, we're asking governments, state and federal, to adopt a set of indicators and targets for mental health. At the moment, we don't know what success looks like because we haven't set appropriate targets for what we're going to achieve in the mental health space. So we think that's an important starting point. Secondly, we're really asking for a reorientation. We're asking governments to think much more about early intervention and prevention and promoting good mental health rather than simply addressing all the challenges that arise when mental health becomes very serious and becomes acute, with all the costs, both human and financial, that entails. We're not suggesting for a minute that we don't need appropriate supports for people who are severely mentally ill, because at the moment we know that they often fall through the cracks and often don't get the sorts of services that they need. But what we are saying is that we also need to reorient our investment so that we act early to either prevent mental illness or prevent mental illness from becoming as severe as it might otherwise. Finally, I'd just like to ask you to think about how you might be able to support our submission and how you might be able to support our advocacy efforts over the next few months. I think it's going to be a very important time. The National Mental Health Commission are due to report to government in November, and between now and then I think we really do have an opportunity together to be working hopefully for a much more substantial and sustained reform process than we've seen. Over the last decades we've seen report after report sitting on the shelf gathering dust and not really achieving the sorts of change that we all hope for. With your support and with our advocacy, we're hopeful that this time round we can achieve some substantial reforms and start to achieve the sorts of outcomes that people who experience mental illness and their carers have waited so long for, and more importantly so richly deserve. So please have a look at our submission. We'll be in touch with you again about ways that you can support our advocacy, but we're keen to build a coalition and to really drive a reform process that actually makes a difference in people's lives. Thanks.